Hi, my name is Ken Cutbush. I'd like to talk to you about the risks related to revising a shoulder replacement to a reverse shoulder replacement, specifically the risks of revising a total shoulder arthroplasty or a hemiarthroplasty to a reverse shoulder arthroplasty. What do I mean by a total shoulder replacement or an anatomic total shoulder replacement or a hemiarthroplasty? What I mean is something that looks like this. This is a total shoulder arthroplasty or joint replacement, and it's an anatomic type because we have a ball on the humeral head, and on the other side, on the socket side, we have a socket. And you can see there is a plastic socket in there, and there's a little x-ray marker there, just there, that you can see there. So that's an anatomic total shoulder replacement. A hemiarthroplasty, which means a half joint replacement, looks like this, but it doesn't have the socket on this side. It's just the humeral side. So when we revise either of those two, so an anatomic total shoulder replacement or a hemiarthroplasty, we will invariably revise it to a reverse shoulder replacement. It's called a reverse shoulder replacement because the ball and socket are reversed. You can see here the ball is now on the shoulder blade side, and the socket is now on the arm bone side. And that's one of my cases, and you can see we've taken this to the reverse. What are the risks of that? Well, if we look at a scientific paper published by Walsh et al. In the Journal of Shoulder and Elbow Surgery in 2024, and if you'd like to look at the scientific paper itself, just scan that QR code and we'll take you to the paper. They looked at groups of total shoulder arthroplasties and hemiarthroplasties, and they found a re-revision rate, so a need to revise these, of 15% for total shoulder arthroplasty and 11% for hemiarthroplasty. That's fairly similar to Australia data. The complication rate for those surgeries, the complication rate revising a total shoulder arthroplasty was almost a quarter, 25.9%, a little over a quarter actually. And for a hemiarthroplasty, a little bit less, 21.7%, so a bit over 20%. The complication breakdown, if we look at it, glenoid loosening occurred in 6%, fracture occurred in 4.7%. You can actually see I've got a little fracture here that has had to be repaired at the time of the surgery. I actually had to remove this whole stem by splitting the humerus down to here to actually get this out. And you will note that the reverse here has a longer stem so that we get past that area, so we get good fixation. Infection ran at 3.3%. Dislocation was 1.8%, so the shoulder replacement dislocated after it was revised. Instability, so the patient had a feeling of looseness in the shoulder, of it being unstable, 1.6%. Humeral loosening, so loosening of the actual stem itself, 1.4%. And less common and perhaps persisting problems were those of persistent pain, hematoma, and neuropathies or nerve issues. So that's a good overview of risks related to revising an anatomic total shoulder replacement or a hemiarthroplasty, and I hope that gives you some understanding of what to think about when you're considering this sort of surgery. Thank you for listening.